First at 5:30, Friday will be a big day for many people across Rhode Island. Good evening. I'm Kim Kalunian.
I'm Mike Montecalvo. October 1st is the deadline set by the governor for healthcare workers to get vaccinated or risk losing their jobs.
12 News reporter Courtney Carter spoke to the head of the Rhode Island Healthcare Association about how many workers are expected to be out and what that now means for nursing homes. Courtney?
Well, the head of that association says this is, of course, going to be a major issue for patients as well. He says he knows nursing homes that have stopped accepting new admissions because there's not going to be any staff to take care of them.
The October 1st vaccination mandate applies to thousands of healthcare workers in the state, and that, of course, applies to nursing homes as well.
To be vaccinated by October 1st or else they can't come in.
John Gage, president and CEO of the Rhode Island Healthcare Association, says while he is for vaccinations, he feels like it's a complicated situation for the healthcare industry.
We started out the pandemic with staffing challenges. We've had 18 months where our staffs have been coming to work in the height of the pandemic when vaccines weren't available, when PPE was certainly not plentiful. And they did heroes work.
He says hundreds of unvaccinated workers will be out of jobs.
I mean, the health department reported 706 people could be impacted.
But he says there is a 30-day staffing contingency plan nursing homes can follow if they file for one.
That they take advantage of the enforcement strategy that the Department of Health came up with. And basically you tell them what your plan of correction would be to become 100% compliant by the end of October.
He says they're going to ask vaccinated workers to pick up extra shifts and use temporary and traveling nurse agencies to make up for being short-staffed, but says it will hurt patients most.
I know there are buildings that are holding off on admissions or have units that are temporarily closed because they simply can't get the staff to provide care.
The State Department of Health says as of September 13th, 87% of healthcare workers in the state were vaccinated. I'm Courtney Carter, 12 News.